Welcome to Steinberg Diagnostic. This is our Hippa and Security Series training that focuses on advanced email. The purpose of this training is to raise awareness about how each of us can protect our patients and to help you better understand the risk and hopefully help you learn how to reduce the risk as well. This training is for all SDMI employees, students, or even volunteers. This training is going to answer most of your questions, such as why me? Why now? What's considered as EPHI, and it'll also help you know what you need to do to protect it. You've probably been hearing it from news, from TV, basically from everywhere, that theft of electronic data is exploding. This threatens everyone's data, not just our patients, but also yours and mine. Another reason why we're focusing on advanced email security is that federal, state, as well as SDMI policy requires us to know how to secure EPHI, mostly when it is being sent through email. The IT department has put in place all the necessary tools to secure the information. That's what Microsoft Outlook and WinZip Companion is for. But even with those tools, we still need you to implement this. We still need you to determine if it contains EPHI, and we still need you to ensure that if it's being sent encrypted to the destination. Basically, you're a big part in making sure that all that is done correctly to protect our patients. Before we move on, we just want to make sure that all of you understand what EPHI is. EPHI stands for Electronic Protected Health Information. It's our patient's health information, financial information, any patient information that needs to remain confidential. Some examples are their medical records, billing information, and even their films. We all need to take extra precautions when sending these informations through email. When we talk about workstation, this usually applies to the use of Steinberg workstation here in any of our locations. It also applies to Steinberg provided workstations, whether it's a laptop or an offsite PC. It even applies to your own PC at home. Even though it's not a Steinberg provided PC, but because you're an employee of Steinberg, and for some reason you had to work with EPHI, this will then apply to you as well. Now remember, all of you are responsible for your own actions when it comes to EPHI or any confidential SDMI information has. When it comes to email, the first thing you need to learn is that information is never secure with email. As much as possible, you always want to avoid using email for EPHI or confidential SDMI information. But of course, this is not realistic at all because email is one of the major ways of communication now. Another thing you need to avoid is never use a non-SDMI email account, such as Hotmail or Gmail, to initiate communication that has EPHI. Why? Because you could be exposing our patients or confidential SDMI information to the world. Even if we have our own secure email solution, it's not going to secure these transactions at all, which is why it's important to use the proper steps when sending EPHI. So what are the steps? The one thing you need to remember is to use the secure email solution that we are giving you. This solution will at least encrypt, at the minimum level, all the outbound emails. After this, I'll show you how to use the solution step by step, and I'll also provide you a quick reference guide as well. Here's a couple things that you need to remember as well when sending EPHI through email. Number 1, limit the amount of confidential information to the minimum. If they don't need to know that the patient has an MRI of the brain last week, then it shouldn't be included in the email. Number 2, you'll need to delete any personal identifiers when possible. For example, if you need to send a scanned document containing EPHI, delete all the information that the receiver doesn't need to know. If they don't need to know the Social Security, then block it off before sending it. Here's a couple questions that I usually hear when it comes to secure email. Secure email question number 1. I am a scheduler at SDMI, and sometimes I work at home to communicate with patients. Is the communication secure? Secure email question number 2. I am a SDMI scheduler and routinely receive emails from referring physicians that contain patient confidential information. Does the secure email solution protect this information? What is my responsibility when I receive these emails? And here's the answer to both questions. Our secure solution only works on-site, and specific software must be installed for it to work properly. So what you need to remember is that it'll work on designated workstations only. If you decide to move to another workstation, you need to ensure that the workstation you're working on has the solution as well. If not, either have it installed if possible, or you cannot send EPHI through email on that workstation. Now, as for working from home, we typically do not require anyone to work from home. But things change, and if it does in this situation, then you need to know that you cannot send EPHI from home. Mostly if you're using Outlook Web Access. There are specific workflows that you'll have to follow if you decide to work from home for any reason. Now, as far as protecting EPHI, you need to protect all EPHI, whether you receive it or send it. You have to secure all confidential information on any system, and that could be anything from saving a document to a designated secure area to using our secure email solution when sending EPHI through email. And one major reminder, only use the minimum necessary information when sending EPHI. And last but not least, as with any Hippa rule, there are consequences if you violate them. It could range from $100 to $25,000 to even a year of jail time. But not only that, you'll also have to face fines and penalties from the state and also face SDMI corrective and disciplinary actions as well. So just remember, protect our patients' confidential information just like it's yours, and you'll be completely fine. Thank you for taking the time to watch the Hippa Series Advanced Email Training. Any questions or concerns, feel free to call the IT or any of your Hippa officers. Thank you very much.